where we uncover the often hidden challenges that shapes our lives. Today's focus is on gender and health, a topic that doesn't always get the attention it deserves, but one that deeply impacts every one of us. Gender affects how we experience health, physically, mentally, and emotionally. From societal expectations to systematic inequalities, the way health is treated often depends on who we are. Through the stories of our guests today, we'll explore how gender norms influence health and why this matters to all of us. Let's begin from hearing from someone who carries the weight of caregiving within her family. Please help me welcome Mrs. Princess to the show. Mrs. Princess, thank you for being here today. So you're a wife and a mother, a role that society celebrates, but one comes with many responsibilities. Mrs. Princess, can you give us what your typical day looks like?
Thank you for also having me here. My day starts before sunrise. I wake up early to make our breakfast, to prepare my kids for school, and then I handle household chores. If someone in the family gets sick, I am the one who takes care of them, whether it's giving them a medicine or staying up all night just to make sure they're okay.
That's a lot of shoulders, Mrs. Princess. And how this affect your health, both physically and mentally?
To tell you honestly, it's hard. There are days when my back hurts from all the work, and I rarely have time for myself.
That's a common story for many women. But it doesn't mean it's okay to ignore your health, Mrs. Princess. Have you ever thought about ways to make your women less overwhelmed?
Yes, Miss Leah, Mom. I've started to realize that I can't do everything alone. My husband helped me when he can. I've been teaching my kids to be more independent, but it's like a process. And I still feel guilty for taking time for myself, even though I know for myself that I need it.
Thank you for sharing that, Mrs. Princess. Your story shows the strength and love of caregivers like you, but it also highlights something we all need to learn. Okay, you can't pour an empty cup. Taking care of your health isn't selfish; it is essential. If there's one message you would like to share with your fellow mothers out there, Mrs. Princess, what would it be?
To all the mothers and the wife out there, I'd say that don't be afraid to ask for help. Don't feel guilty for taking time for yourself. It's not just for you, but for your family.
Thank you so much, Mrs. Princess. That's such a valuable lesson. Your story reminds us that how important it is to care for our caregivers like you. We really appreciate your presence here in our talk show, Mrs. Princess.
Thank you for having me here.
For our viewers out there, stay tuned because we will be right back. Did you know that 70% of women experience untreated mental health conditions due to societal pressure to do it all? Gender norms push women to prioritize others, leaving them a little time for their own well-being. Let us break the cycle. Prioritize her health. Empower her life.
Healthcare is a right, not a privilege. Yet, gender norms deny millions fair access. Women face bias in treatment, and men delay seeking help. Gender shouldn't dictate your health. Together, let's create a world where care is equal and health is universal. Health has no gender.
Welcome back to our dear viewers. Today, let us hear from someone who is a husband and a father who is challenging the traditional roles, who is being actively involved in caregiving. Please help me welcome Mr. Shallow to the show. Mr. Shallow, how are you?
Good.
That's great. Mr. Shallow, many men feel pressured to man up and avoid showing vulnerability. How has this affected how you approach your health?
It's not. As a man, I feel like I need to be strong all the time. If I get sick, I hesitate to see a doctor. It feels like admitting a weakness. There's this fear of being judged or even discovered something serious.
That must be challenging, Mr. Shallow. How does this mindset impact your life and your family?
Honestly, it's not good. Ignoring my health sometimes makes things worse, and it affects my ability to provide for my family.
What would you say to the other men who feel afraid or pressured not to seek help?
I tell them that it's okay to ask for help. Taking care of your health is important enough to be there for your family when they needed you the most.
Thank you so much, Mr. Shallow, for sharing your story to us. Your story shows that real strength is about taking action and prioritizing health for yourself and for the people you love. To our viewers out there, stay tuned because we will be right back. Men are 33% less likely to seek medical help than women. Why? Because gender norms tell them to tough it out. But ignoring physical and mental health can cost lives. It's time to redefine strength. Seeking help is courageous, and real men take care of their health.
Across the globe, gender stereotypes shape how we access and receive healthcare. Women's symptoms are often dismissed. Men's concerns go unspoken. It's time to challenge the norm and ensure everyone gets the care they deserve. Health isn't biased. Why should care be? Health equity starts with us.
Welcome back to Unspoken Truths. Now we will hear from someone on the front lines of healthcare. Gwen is a doctor who witnesses these challenges every day. Gwen, as a doctor, you're on the front lines of healthcare. Thank you so much for being here today.
Thank you so much, Leah, for having me, and I'm very privileged to share all of you what I have seen and experienced inside my work.
Dr. Gwen, what are some of the most common challenges you've seen related to gender and health?
Leah, as a healthcare provider, one of the challenges I have seen inside my work related to gender and health is that different health conditions or approach are being treated differently based on gender. For example, women's pain are often dismissed as being emotional or being too exaggerated, and for male, they are less likely to seek support unless their conditions are worsened. And these patterns leads to delayed care and more serious healthcare problems.
That's a deeply concerning. What about the patients from marginalized gender groups like LGBT communities? How does the system affect their care?
For LGBT patients, they often feel or mistreated or disrespected inside the healthcare. And it's very sad, Leah, that there are LGBT patients or individuals who avoid to seek help or support from healthcare because they feel unwanted or they feel they are being judged by the society. And it's very heartbroken because we are all humans, whether you are male, whether you are female, or whether you are lesbian or gay or whatever gender you have. It is very important that all of us must be treated equally, especially in the healthcare system.
What changes would you like to see, Dr. Gwen, to address these disparities?
One of the important things is we must give more inclusive training for healthcare providers, especially gender inclusive training. So as a healthcare provider, it is very important for us to build a rapport relationship towards our patient, whether what gender they have. We must treat them equally and with respect.
Thank you so much, Dr. Gwen. Your insights reminds us that systemic changes and personal advocacy both play crucial roles in creating a fairer healthcare system. Thank you for joining us on Unspoken Truth. Take care and see you next time.